Disclaimer. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on The Heavy Truth.
Hi.
Hi.
How are you?
I'm well. Welcome, everybody.
Welcome in. Welcome back to The Heavy Truth. I'm Ben.
And I'm Amy.
And we're here to unpack some real life stories, science, sometimes awkward realities, right? Of our...
Few funny times.
Yeah, of weight management, medicine, obesity, and sometimes fun and strange topics. And I say strange topics because of today's topic. I sent it to you when I was in bed, just scrolling through things. My husband was asleep, the dogs were asleep, and I came across something popped up in an email that I got from one of these science journals or something that I get. And I was like, oh, okay. And the moment I read it, I was like, let me send this to Amy.
And I will say what your question was.
Yeah.
Do you suffer from this?
I did say that. Do you suffer from that?
Yeah. So what's the topic, Ben?
So today's topic, we've talked about Ozempic face, right? So apparently this is a topic which I had never known until I read this. And I did read it. Ozempic Vulva.
Wow.
Yeah. Hello? Yeah. That's exactly what I was thinking too when I read that. Like, this can't be a thing. Is this coming from like The Onion or something that's not real? But no, apparently that's a thing. And again, just like Ozempic face, it's due to weight loss, not because of the medication. So people are just associating it with people that are on these medications because of the rapid weight loss. And it's actually leading some people, by people I say women, men, Producer Mike, you and I will not have Ozempic vulva. Yes, thank God, I know. But are leading some women to get surgery to help with this. Yeah.
Yeah, well, that's, hard to unsee when you read it, huh? How about that?
Yeah.
And you just dived
I think it's hard to
deep.
It's hard to unsee if you see it.
I guess.
Right? Thankfully, there were no pictures. Okay. Right? So
it's good. Yeah. So, I mean, we both work in obesity and bariatric medicine. And, so of course we had to dig a little deeper and what the myth is about the medicine and why are people suddenly talking about this topic.
Yeah. So, Ozempic face is exactly what it talks about, right? The facial area. This is physical changes, that women notice in their vulva area after rapid weight loss, many of them on one of the GLP-1 medications such as Ozempic, Wegovy, or Zepbound. Again, Ozempic is for patients with type 2 diabetes, as is Mounjaro. But there is weight loss associated with those medications, as well as Wegovy and Zepbound, the same medications used on the obesity side. So when we're...
Go ahead.
Go on.
No, I was just going to say, with weight gain or weight loss, I mean, you gain weight everywhere. It's not just in your stomach or in your, your breasts or, your legs, your thighs. It happens in your and as well.
Oh,
that was well timed,
I don't recall
Mike.
ever gaining weight in my down, as RuPaul would say, my that. Yeah. So
Men have extra weight in
They
their
do.
front area.
yeah, so it's really we're talking about the mons pubis and the labia majora, so the areas of the vagina, right? Like the
crotchal region.
The crotchal region. I love. There's a word that Amy clearly made up.
This podcast is brought to you by Arby's Beef and Cheddar.
Yes, not that.
Oh God.
Sorry,
Yes.
Arby's. But you know what? You are right. When I lost weight, I did that mons area did decrease.
And get a little flappy?
Well, no, because I had my fatoplasty, like you've heard me say in other
I know,
areas.
but it did. Did they fix any of that?
Oh, yeah. They gave me a little lipo
lift,
there to get that out. Yeah. But I mean, so what happens so instead of with Ozempic face, Ozempic vulva is kind of the same concept, right? But instead of losing the areas of your cheeks or whatever that become more hollow, or, they're talking about, like we talked about the mons pubis and the labia majora, they lose fat fast, and therefore those areas lose that natural padding, right? So that it starts to sag, looks deflated, which Mike talked about.
Right.
Roast beef sandwich. Sorry for those of you who may be eating while you're doing this. But as a nurse, we could talk about anything and it didn't even matter. We'd still eat lunch. But, and then some women, say it feels different than when they're sitting or having, doing activities or even during sex.
Yeah.
Right.
Right. So, I mean,
You lost weight, Amy. Did you find yourself having Ozempic vulva?
I would not diagnose myself with having Ozempic vulva.
Okay. Producer Mike? No?
My vulva is just fine.
Oh, perfect. Just making sure. Yeah, I just wanted to clarify things, right? And again, to clarify that, the drug is not causing vulvas to disappear or anything like that, right? It is the speed of the fat loss or the connective tissue, right? So that's the issue.
Exactly. So, you just think about an area with any soft tissue. If the weight loss outruns the skin elasticity, right? The elastic of it, the connective tissue.
Say that again.
Things shift.
Say the word again. Elasticity.
Elasticity.
Yeah, that was a struggle for you, huh?
Elasticity.
Mm-hmm.
But no, anytime you have that, and the same thing, like that's genetic related too, right? But
No, I can say elasticity.
no, having loose skin.
Oh,
It's genetic, right? So
It can be.
does
Mhm.
it can reduce the way your skin bounces back.
elasticity.
Well, yeah, for sure.
Because you're losing that
It's the connective tissue.
the connective tissue,
Yeah.
correct? The layers of cushion that support the skin, right? They thin out. So the vulva, the mons, and the labia majora, all rely on that layer to shape it and for comfort, right? And so, when the fat disappears, you find more laxity, wrinkling, looks deflated. And again, that usually can happen with not just in your vulva, apparently, but in your face, your upper arms, things like that.
It's mostly beneficial for men, weight loss.
Oh, yeah. I was going to say,
Yeah.
I'm confused where you were going with all of that, but
Yeah, it's
oh, yeah, because it makes your peeper bigger. Yeah, look bigger. Yeah, which we're fine with that. I'm assuming most women don't want their vagine to look bigger.
No, but if there's less padding, then there could be a better outcome on that end too, because there's not the padding to stop.
Oh, less cushion.
Yeah.
Mhm.
So I think it could be beneficial if you don't mind, the flaps.
Oh my, yeah. And so again, when I was scrolling through this and saw that, I was like, okay, there's that part. As a gay man, I don't worry about Ozempic vulva with my husband,
Right.
right?
Yeah.
Yeah.
That's what I'll talk you through it. If you have questions, you just ask me.
I don't need to know. No, but our listeners do. Our listeners do, right? And so, like you talked about hormones, right? Hormones will play a part in this, right? That fatty tissue helps produce estrogen, and then losing it can slightly alter that hormone imbalance, right? So that's where some patients will have some dryness and sensitivity, and then as we talked about, sometimes that also happens not only with weight loss, but then again as we're entering menopause and things like that,
Perimenopause.
right?
For sure.
How are you doing with that perimenopause, by the way?
I'm not there yet. Like I said, I'm just barely 40.
You've been barely 40 for what, 10, 11 years, 12 years?
It's only a number. It's only a number.
Only a number.
But
Eventually the bread dries out, Amy. It doesn't stay moist.
there's ways to make it moist.
Ew. Anyway, so
anyway, there, you go there, so I will go there too.
I do. You know what? I
Yeah.
do take it there, and then she takes it.
Yeah.
Tries to take it there as well.
Yeah.
Again, the word there is try.
But there is no peer-reviewed study proving that Ozempic Vulva is actually it's a side effect of any GLP-1.
Right.
It's just a clinical observation. Body changes. It's not a new disease by any means. So.
But before anyone jumps to any type of surgeries to fix things, right, or cosmetic things, like using the hyaluronic acid fillers or fat grafts or surgical labiaplasty to tighten or reshape things, right? Before we're jumping to that, there are more conservative options, right?
Well, yeah, because the body's going to adapt to it, right? So it could go back to, maybe somewhat normal, and you have to just give it time, and don't, like you said, don't jump to anything,
Right. And there are specialists for this, right? They can send you to like someone that specializes in more of a pelvic floor physical therapist, right? They help with all of those pelvic floor strength training. What is that? The Kegels, right? And all of that.
Kegels, yeah. And there's even some of like med spas and such. They have like vaginal tightening devices that they use with like lasers and ultrasound. So there's some things non-surgical that you can do if
Creams,
if it's an issue.
moisturizers, topical estrogen for those women, postmenopausal women, can also help with that dryness and all of that we've talked about.
Yeah, right. And I feel like you can't be embarrassed to talk about it.
No.
Right? You have to talk to your provider about it, and if it's a concern for you. But again, I always say with any loose skin, whether it's your stomach, your arms, your vulva, if you've lost weight and you're feeling better and you've improved your health, that's still a win.
That's
right?
true. If you're
Not
feeling-
everybody's looking at your vulva or your saggy
It depends on what you do.
man boobs.
Who is saggy man boobs?
I said not everybody's
You
looking
said
at
your,
that.
meaning me. No, but that's not going to help me with my Ozempic vulva, my saggy man boobs. Yes, thank you. Right. So, but you know what? In the mindset, the bigger conversation is that, for so long, anatomy was treated very taboo, right? So we don't want to talk to people about, I'm having these issues with, my
Their
vagina,
crotchal region?
your crotchal.
Yeah.
As you'd be like, so that's a new word. Is that going to go
It's funny.
into Webster's dictionary
I
next
love
to
it.
crotchal? How do you spell that? Crotchal. Crotchal region. Is there a hyphen in there?
No.
No, just one word.
Just
okay,
one
crotchal
word.
region.
You want an awkward conversation, you give it to us. Like there's
I
nothing
just
that's
gave
going
it.
to, I know, that's not going to make us uncomfortable.
No. Mm-mm. We're nurses first and foremost, and then there's practitioners. We can talk. Like I said, we can wipe your butt, change your tampon, give you an enema, and eat lunch.
Absolutely.
Without
Out of
an
an
issue.
emesis basin.
Out of an emesis basin.
Yeah, for sure.
absolutely. Mm-hmm. Absolutely.
And my goal is to make people uncomfortable during conversations.
Right, because that brings
funny.
Yeah, but it brings up those topics, right?
Yeah.
It's those topics that we need to talk about, and that's when I tell people there's nothing in our practices you can't talk to me about.
No, absolutely.
And now you all know you can talk to me clearly about Ozempic vulva, or not. That's fine too.
Yeah, absolutely. But it's for information. It's not to feel shamed. It's can be completely normal. But it can affect, confidence, sexuality, body image. So and those are all real things.
Yeah, absolutely. And again, share. Talk to your healthcare provider about this, right? Because you can only try to fix the situation or your ailment if you talk to someone. No one knows if you don't say something about it, right?
Mm-hmm.
I
Absolutely.
think that's the biggest thing. So what do you think with this topic, which of course, again, I want to stress, we are not pointing fingers at the medications, the GLP-1s, right? This has been found in the articles I have read. Again, not scientific based, right? Not based on anything or
There's been no studies on it.
no studies on that, right? It's attributed to rapid weight loss.
Right. So if you're, working on weight loss, slower, steadier loss plus resistance training, some good protein
Yep.
intake that may all help.
Yeah.
You notice any pain, dryness, or irritation, talk to your provider. That's what they're there for.
Yeah. There can be real solutions for all of this, right?
Mm-hmm.
Yeah.
Besides surgery.
Yes.
You
Don't
know?
just jump right away to that surgical intervention.
Mm-hmm. You know, so bottom line is, if you're unhappy with your vulva, there are options.
Yeah. Keep your vulva happy.
That's right.
Is that what you're trying to say?
Yeah. I mean, you know, don't feel bad about it. Just go get support. Whatever that
Does
looks
your vulva
like.
need support? It's happy.
Yes.
Yes, it needs
absolutely.
support, or
It's
it's happy.
happy.
It's happy. Producer Mike, is it happy?
It's happy.
I'd say so. Yeah.
Oh, okay. Well,
Yeah.
I'll Amy, I will take your word.
Her is really happy.
Oh,
Wow.
wow on that. And
He really likes that button.
yeah, and apparently you're very happy. And I'm happy that it's happy because
I mean, you'd be the first to know. I would tell
why be
you.
the second to know if it wasn't happy, right? Because the first would be you.
All right.
And then I would just be the one that would be prescribing anything because it's
Yeah.
unhappy.
Yeah. It's fine. That's fair. Yeah. So
Oh,
until then,
until
we're good
then,
here.
I am very good here with this subject.
Yes.
Absolutely.
I know.
Absolutely.
If there's anything else awkward and cringy you guys want us to discuss, we are open to it.
Yeah.
Send it our way.
Some of these topics that I see that roll across, it's a good topic to talk about because it's amusing. It's
Yeah.
amusing. We laugh about it, right? It makes weight loss something we could talk about, you know. And there are these side effects to different things, whether it's your vulva or your face, or you know, whatever.
Yeah.
But I hope I don't want to have Ozempic face and Ozempic vulva. I feel like that's sad, right?
Well,
Wah, wah, wah. Anyway,
well, until then, keep chasing health and not hype.
oh, that's nice. You should put that on a
You like
on a
that?
shirt. I do like that. Keep chasing health and not hype. Yeah,
Yeah.
that's great.
Like that.
So until next time, I'm Ben.
And I
Oh, she's been beeped.
That's
Maybe
fine.
maybe I'm getting a new co-host. It's going to be Ben, and then we'll fill that in later.
You can say it again. Go ahead.
No, it's fine. Everyone knows who I am.
She's Amy, whose vulva is happy. And this is The Heavy Truth.
I'm the heavy truth.
Bye.
Bye.